Hello, my name is Chase Seal, and I'm a senior at McKendree University. And today I'm going to tell you about the effects of aquatic exercise on the bone health of older adults. So, age related bone loss is currently one of the largest contributors to healthcare costs for older adults over the age of 65, with the number of Americans over the age of 65 expected to double by 2040. Age related bone loss is a looming epidemic. Water based exercise has been shown to be favorable for older populations because its anti gravity effects can have a cushioning effect on impacts. But can this really help prevent age related bone loss? So, for this project, I did some research and I found two pretty good articles that should be able to explain this. And Article 1 is titled The Effects of Water Based Exercise on the Bone Health of Middle Aged and Older Adults, a Systematic Review and Meta Analysis by Vinny Seamus et al. Article 2 is titled Bone Mineral Density and Bone Marker Turnovers in Postmenopausal Women Subjected to an Aqua Fitness Training Program. And this was by Christian Vachna et al. And this was published in the International Journal of Environmental Research and Public Health. Article 1 really focuses on exploring the effectiveness of water-based exercise as a way to prevent age-related bone loss. And how they conducted this study was they did a search of all academic databases, stuff like JSTOR, online stuff, and of all their selected literature, they conducted critical narrative synthesis and meta-analyses. And they also did this for the effects of land-based exercise so that then they could be used as a cross-reference point for water-based exercise. And what was found was that water-based exercise may have a positive effect on the bone health of older adults, but this effect is less than that of land-based exercise. The author suggests that water-based exercise be used for populations that are at a high risk of fractures. And while the benefits are less compared to land-based exercise, the risk of fractures is much lower whenever you're talking about water-based exercise. Now, Article 2 really focuses on the effects of deep water aqua fitness training on bone tissue. This study was actually using like physical subjects. And so they measured the bone mineral density, bone strength index, and biochemical indices of the subjects. And this study had an emphasis on deep water, which they classified as the water going up to the neckline. This study was conducted on 18 postmenopausal women between ages 54 and 65. These women were separated into two groups, training and control. The training group was then subjected to an aqua fitness program. The bone density of the hips and spine were measured before and after the training program. And the subjects' OC, C-terminal telepeptide of type 1 collagen were also measured. It was found that the aqua fitness program can result in favorable changes to the femur strength index of postmenopausal women, but more research is required. They also found that there was no significant difference in bone mineral density between the training and control groups. A lack of change in somatic and bone turnover markers was also shown. And this right here is just a little bit of data. As you can see, some of these numbers aren't exactly significant changes, but if you look over here at the femur strength index, the assessment at 6 months shows a real significant change in the training group's numbers here. And right here, I just have my references. And that's going to be it for me.